on Instagram and YouTube. So before we start our question answer session, uh, we have some questions on my Skype also and WhatsApp also. So before, if you don't have any question live, we can directly start our question answer session. Now, before that, again, I would like to discuss one of the very important cases. Yeah, welcome, Dr. Sharma. Very important case where the patient, it was a case of caries, a classical case of caries. So I'll welcome Dr. Smith, Dr. Sharma, Dr. Venkat. Yeah, so Dr. Venkat's case is there. Namaste Venkat ji. So आपका केस हम लेंगे अभी, just a minute, because I'm live on the mobile. So I'll just take the case. Dr. Sandesh, good afternoon. I had a very interesting case, of caries of teeth. Glass, which I'll discuss after. I'll discuss now only. Yeah. Hello, Dr. Babil. So I had cases of where there is a caries of teeth of a child, and he responded beautifully to creosote. And very important symptom in relation to creosote teeth I'll like to discuss. If you have ever tasted had the smell of creosote, it is really good, and it is where it's like menthol like smell of creosote mother tincture. So very interesting symptom the child had. I'll just tell you the symptoms. The child had very painful dentation, and because of that the child did not sleep, and the teeth used to decay very fast, and there was a lot of bleeding from the gums, and the teeth were very dark in color. Of course, rule out if the patient is taking a lot of iron. Taste from the mouth is very putrid and very bitter taste. Creosote 200 for 2 days, and we called him after a month, and we had a very good results. Whole the tar, the blackness, the bleeding, the pain, everything gone with creosote. With this symptom, we compare actually two remedies with that. One is Stephisagria, and the second is anybody? One is Stephisagria, and the second one is so creosote. Second one is antim crude. Yeah, welcome, Dr. Bilwalkar. So this is the symptoms which I took for prescription for that dentation problem. The symptom were the very painful dentation the child had. He could not go to sleep because of that, and teeth decay very fast. There was bleeding gums. There was dark. The teeth were dark and very crumbly. So creosote was given. Offensiveness was also seen, and other symptoms also. But these are the symptoms of teeth. Do compare that with Stephisagria and antim crude. No, misery, no, antim crude and Stephisagria. So we had a case of. I had a case on the WhatsApp, so I'll just read that case. Destructive tendency, mental tendency, no history, nothing in the pregnancy, restless, always plays with himself and the kids, jumps on the parents and grandparents. Most of the cases of ADHD, have these type of symptoms which are very common to the disease. So whenever you are taking this case of ADHD, or whenever you're taking a case of hyperactive disorder, make sure that you basically take some symptoms of the patient and not symptoms of the disease. For example, ask the patient in the family history whether the patient in the family was suffering from any syphilitic disorder, like cancer, like renal failures, like these type of syphilitic disorder, autoimmune disorders and all. It is not always important that you ask the symptoms of the child. The past is also very important. How was the child born? Was there a forceps delivery? Which medicines the mother had at the time of pregnancy? And then the symptoms of the child basically differentiate between the common symptom of the disease and the symptoms of the personality of the child, of the constitution. That is more important to get the remedy. So with this symptom, only this symptom, I think, because if you repetize, most of the ADHD cases would get remedy which are very destructive. Like as you always said, tarantula is there, destructive remedy. And so sometimes, like tarantula is there, like hyoscyamus is there, like stramonium is there, like veratrum is there, tuberculum is there, hyoscyamus is there, belladonna is there. So these are all destructive remedies. So 8 out of 10 cases of ADHD, you will get these type of patients and you will prescribe and you will fail. It is not always that. These are symptoms of the disease. See the symptoms of the patient, see the hair, see the skin, see what hobbies he has, see what he does when he's absolutely alone, or what he does, what he likes to do. Those are very, very important symptoms to take in case of ADHD or any hyperactive disorders. So just take that symptom and get back to me, Dr. Venkat. Arni 96, welcome, Dr. Simarach. I hope I have pronounced right. Welcome. Dr. Pandey says urine stream very feeble, taking causticum 1/8 fortnightly in a 65 years man. Your opinion expected. See what happens, Dr. Pandey. If the stream is very feeble in 65 years of man, you can always think of a stricture or a prostate. So in feeble stream, see there are so many remedies, not only causticum. So I would like to ask you, what symptom do you take more of causticum? What symptom more do you take of causticum? That is important. Yes? See, just because the stream is feeble, you take causticum, you may not get the result. You have to have some other symptom to prescribe causticum. So otherwise, you'll have lots and lots of remedy for these type of complaints, feeble stream and thin stream, these type of complaints. But it is important to get the whole case. Of course, if you only want these type of remedies, that feeble stream remedies, you can always have lots of remedies. You can write down. You have remedies in this case like what you call phosphorus, thiocyanaminium, calcarephos, pulsatilla, conium, arsenic. These remedies have these type of streams, feeble streams. But you have to have some more symptom. More symptom of the constitution. More symptoms of the constitution. That is more important. I would like to tell you one thing. I had a case of post-COVID lung fibrosis. The whole lung was fibrosed. So can we have a remedy where can we cure a case of fibrosis of lungs totally with homeopathy medicines? Anybody? Lung fibrosis, the patient could not speak properly, had a lot of cough symptoms, could not walk long distance, oxygen saturation was less, lung fibrosed totally. Already had taken a lot of steroids, but it was not working. So he came to me. It was maybe 4 months back. Yeah, Dr. Tare, welcome. Dr. Mayur Tipare, Dr. Fatima, welcome. Dr. Razia. So I was just asking you all, case of lung fibrosis, total fibrosis. So what you can help with homeopathy? What do you expect in homeopathy? Anybody? Can you cure the whole fibrosis? Can you cure the whole fibrosed lung and get it back to normal? Anybody? Can we have some answers? Anybody? Can you get back the fibrosed lung? Okay, I'll maybe wait for your answers, but because we have a lot of cases of COVID, post-COVID fibrosis now, and there are a lot of cases who have total fibrosed lung, cannot breathe, are on oxygen, saturation is low, always put on steroids or always carrying oxygen cylinders with them. So homeopathy does have a very good role in these type of cases, and we can definitely give them the results. But Istanbul, okay, I don't know Dr. Pandey number. So I was just telling you something about this COVID type of cases, and you will definitely have in homeopathy we have definitely good results, and it would basically heal the patient. I had these type of cases, where the patient was fibrous, and after 4 months we repeated the CT scan, and the scan said complete resolution of the lung fibrosis. The whole lung fibrosis was cured with homeopathy medicine. Now I can use the word cured because the CT scan report before and after shows absolutely cure of that fibrosis lungs. So this is the science homeopathy, that we should always try to give cure to the patient in these type of cases also. And that's why your case taking, your interpretation of symptoms, your understanding of rubrics, and then your prescription of remedies should be very, very precise and very, very spot on, so that you are able to give such good type of results in your case. In future, maybe I'll post that type of that case, because I have posted in few journals, so I cannot post you, but I'll definitely post you that report before and after. It has got a very fantastic results. Okay, welcome Dr. Devyani. Okay, you can always start asking questions, because otherwise I'll start answer matter medical. Now, optic nerve atrophy is definitely treatable. I have cases where the patient is better but not totally cured, Dr. Sandesh. And I'm practicing homeopathy for the past so many years, and whatever question I had, can I cure fibrosis of lungs? Can I cure coronary artery disease? Can I cure diabetes? Or can I cure renal failure? All answers I have got from my practice only. I have cases where I'm able to cure these type of cases. So in homeopathy, the homeopath doctor is basically the limiting factor and not the pathy. Take the case properly, repertorize properly, study your mathematics, and you will get wonderful results. I was just talking you. No, the medicine I told you, this cases have been printed in a journal. So after a few days it will be out in a journal, and then you can read that. It is not an out of the world it is a very polycrest remedy, minimum remedy, and everybody has used it day in day out, single dose. But it was an interesting game which I'll share you after some time. I was just eager to tell you how homeopathy can help you in these type of syphilitic cases also. Of late, see, you will remember, you will get lot of cases in post-COVID. There's lot of cough or lot of fibrosis or lot of bronchitis or bronchoria in cases, these type of cases. In this, I have seen that the color of the sputa becomes a very, very interesting and very, very prescribing point in your inpatients. I had a case, where the patient used to tell me कि जब भी मैं खांसता हूँ, whenever I cough, the cough is blackish in color. I feel as if the cough is here. I cough, a lump comes out, very, very sticky, and I feel better. Again, the cough comes, the lump comes out, and I feel better. So when the lump comes out, very, very sticky lump, blackish in color, and then I prescribe the remedy. Yeah, welcome, Dr. Avantika. So which remedy comes to your mind? Where the sputa is blackish in color, very, very sticky, it sticks here, then it comes out, the patient feels better. With this symptom only, I had, happy Makar Sankranti, Dr. Suresh and everybody. So, which remedy comes to your mind? Which remedy comes to you? The sputa is blackish in color. Crocus sativa, okay. Anything else? See, whenever the sputa is blackish in color, 2 or 3 remedies which are very, very important that you have to remember. The first, and you'll be surprised, the remedy is Kali Bichrome. Yeah, elapse is there. I was coming there. The remedy is Kali Bichrome. I gave that patient Kali Bichrome. Second is elapse. And third, which is the remedy which I have used so many times in my practice? Belladonna. Simple belladonna also has blackish sputum, and in so many cases of post-COVID cough, post-COVID bronchitis, I have used these 3-4 remedies and I have got very, very good results. Suppose if the patient says the sputa is not blackish in color, it is brownish in color, and you can actually, the patient can actually say, because he can see the sputum, when it comes out, you can see the sputum, brownish. Welcome, Dr. Homeopathy. So whenever there's a brownish sputa, surprisingly, whenever there's a brownish sputa, we think about remedies which are not to be expected. But for brownish sputa, always think about carbo wedge and carbo animals. These 2 remedies have given me such good results in these type of cases. Of course, there are a lot of remedies and I have used those remedies, but these 2 or 3 remedies, carbo wedge, carbo animalis, and arsenic. Why I'm telling that? Because whenever a carbon comes, like carbo wedge, we expect the sputa to be bluish in color or blackish in color because of lack of oxygen. But in carbo animalis and carbo wedge, the sputa is brownish in color. And that's why it is important to basically not to be prejudiced. Whenever you're prescribing, you should not be prejudiced. Otherwise, you'll basically miss a lot of remedies. So carbo animalis, carbo wedge, and arsenic album. Yeah, welcome, Dr. Gaurav. In some cases, I found that must also have been seeing the sputa is greenish in color. The sputa is greenish in color. And whenever you have seen the sputa is greenish in color, three remedies or 3-4 remedies come directly to our mind. The first is, of course, pulsatilla. The second is natrum sulph, and the third is sternum metallicum. But there are so many remedies, but the sputa is greenish in color and they have given me very good results. Anybody who can answer? Sputa is greenish in color. Sputum, sorry. Can we have some remedies? I'm not going into, good afternoon, Dr. Meera. I'm not going into that modality of what you call in the morning or in the evening or in the night, because that will be too subrubic. But in general, if the sputum is greenish in color, we have pulsatilla, we have sternum metallicum, we have natrum sulph, but there are some remedies which are very, very important, and natrum sulph is definitely there. Okay. But I have found 3-4 remedies which are very, very useful in these type of sputa, because see, after post-COVID, there are a lot of cases of bronchitis, recurrent bronchitis, a simple operates infection. The sputa comes greenish. Remember, natrum sulph is there, pulsatilla is there, sternum metallicum is there. Remember a remedy which is very, very important. I have seen a lot of good results. Paris quadrifolia. Remember Paris quadrifolia, and of course one remedy also which you have never thought, that is ferrum metallicum. And the third remedy, calcarea silicata. These three remedies please add in your matremedica, which is clinically I have seen a lot of cases. Apart from these 4 remedies which are very, very commonly used, these 3 remedies have given me good results. Of course, greenish sputa, if you open the repertory, there may be hundreds of remedies. But these 4 remedies which are very common, and the rare remedies which have given me good results: Paris quadrifolia, calcarea silicata, and ferrum metallicum. So we have one question. Give some indications of medicines for current acute coryza. Many a times all Bryanner symptoms appear, but it does not give result. See, the most difficult disease to treat, if you ask me also, Dr. I don't know the name, Dr. Redens Wong, is coryza, सर्दी. क्योंकि हम क्या बोलते हैं कि भाई अगर if you have coryza, it gets better if you take medicine, it is better in 7 days. If you have coryza and if you don't take medicine, it is better in a week. Okay, so scope of homeopathy in pterygium, I'll come to you, Dr. Venkat. So acute coryza, there are 5-6 remedies which I have used, and if I don't get a case properly symptomatically, for acute cough and coryza. Remember, some remedies are very, very important. For the first remedy, you must always think is, of course, the Hipar sulph. Think of Hipar sulph, think of Rustox, think of nitric acid, think of Eupitorium perfuratum. Very, very common remedies. Or the rare side of remedies, think of one remedy which will give you good results. You might not have thought of that remedy. Eucalyptus will give you good results. Second, Justicia adatoda. It's though rarely used, but it has got very, very important symptoms, and you can get good results with that. Third remedy that you must think about is Hydrastis canadensis. And fourth remedy you must think about, I don't know whether using bowel nosodes, but that remedy is cyanotic bacillus. These are very, very rarely used medicine. Of course, Hippozyna minim is also there. So these 4-5 remedies are very, very infrequently used, but definitely very good results in case of this type of acute cough and coryza. Of course, then we can all add that those remedies which are chilly, like Hipar sulph, like phosphorus, like arsenic, those are there. But these also will give you very good results. Pterygium, Dr. Venkat, if you are asking me a scope, next time you must always feel that everything is curable with homeopathy if you have good results. Pterygium, I have few cases. Those cases are better, but not totally cured. Okay. Teeth has started cracking in 80 years. In 80 years, maybe, if Dr. Indrajit, if in 80 years, if the teeth has started crackling or cracking or crumbling, maybe old age, loss of nutrition, less of calcium, these are basically you have to take care of. And if you want some remedies, you can think about remedies like fluoric acid, calcarea phos, calcarea fluor, calcarea carb, thuja, and the lacasis. Calcium is, in remedies also that those calcium is there, calcarea carb is there, calcarea fluor is there, calcarea phos is there, staph is there, lacasis is there, and thuja is there. Whatever I can remember now. Argentum nitricum, Dr. Purva, I didn't get you for what you have answered. Sorry. Valeriana mendorica, welcome. So immediately let us get back to some other things. I was telling you something about the what do you call color of the sputa. I hope you're understanding what I meant to tell you, because this is basically what I have seen in my practice. That's why. If you feel that this is too much like brownish sputum or greenish sputum, I was talking something about. One thing which I have seen in my practice, where the sputum basically is yellowish in color, and whenever the sputum is yellowish in color, lots of remedies are there. In yellowish color, the remedies are more than the remedies present in green. And whenever the sputa is yellowish in color, you have to think about 3-4 remedies, very, very common: Hipparsulf, Calcarea sulf, Hydrangea, Lycopodium, again Pulsatilla, and Sterum metallicum. Very, very commonly used. So we have sputa. These are the common cases I have seen when the sputa is blackish in color, sputa is greenish in color, the sputa is yellowish in color. Okay. Sir, how often do you use bowel nostrils? Yeah, so doctor, not too often, Dr. Valeriana, Dr. Valeria, not too often, but if sometime the case is there and I exactly know that mathematic of bowel nostrils, I have seen that and I use those remedies. Not so frequently. Most of them I use basically in normal potencies, then LM potencies, and then these bowel nostrils. Not too often. Green discharges, yeah. So these are very, very common symptoms, and that's why I like to share the common. So if you can treat those common symptoms and common, this is very important to develop a practice. So in green, do remember some common remedies like natrum sulf, pulsatilla, sterum metallicum, I told you, and rare Paris quadrifolia, I told you, calcarea silicata, I told you, and ferrum metallicum, I told you. Rare discharge. Of course, there are so many. Okay, green. You were telling argentum nitricum for green discharges. Argentum nitricum, more than argentum nitricum, Dr. Purva, for green discharge, think about argentum metallicum. It has more mark. Argentum nitricum, I have never read anywhere green discharge, neither have I given to the patients, but definitely argentum metallicum, I have given in lot many of cases for green discharge. I would like to share my experience. 40-year-old lady had hematuria and was better with one dose of your single dose, and also used Artigare without. Thank you. Oh, fantastic. Fantastic, Dr. Meera. And you'll be surprised that when I did that YouTube video for UVRC skin, in the next day only I got that symptom urticaria without itching, and that was again cured with a single dose of ORC 200. I took that video, urticaria 200, just because ORC, because everybody knows everything about ORC in relation to urinary tract. But nobody thinks about ORC in case of skin symptoms. So I'm very happy, Dr. Meera, that you got the result, and I think you heard that YouTube live. So I'm very happy that you got that result with single dose, and that is what we basically are here for in YouTube live, to discuss cases and to discuss mathematica or application of homeopathy live and very clinical. So thank you, Meera, for sharing your used Sambucus nigra. Yes, Sambucus nigra for cough complete. Yeah, Sambucus nigra. See, if you open cough mathematica, you will have a lot of remedies. Sambucus nigra, of course, is a fantastic remedy, and it has its own different symptoms, But I was just sharing my experience in treating this Sambucus cases which I have treated in my practice. Sambucus nigra definitely is a fantastic remedy. So can we have some more questions? You ask questions fast so that I like to answer very fast, Sorry. Okay, argentum metallicum. So argentum metallicum I've used, and it has got a fantastic results in green discharge. So Dr. Purva, I hope you corrected yourself. I think you wrote argentum nitricum. I didn't know. I just saw argentum. Okay. Sambucus nigra. Can we have some beautiful symptoms of Sambucus nigra, which should be thought of whenever I prescribe in Sambucus nigra? In Sambucus nigra, one symptom which is very, very important. Okay, Dr. Purva, very nice. That's argentum metallicum. Snuffles in infants, preventing breathing and nursing. That is a very, very important symptom of Sambucus nigra. Second, there is rattling in breathing. And third, the Sambucus nigra, there is larynx, there is lot of cough, and the child awakens, suffocated in the night, face is very livid, turns blue, grasps for breath, can inspire but cannot expire. That is Sambucus nigra. Yes, night aggravation. I was just, see, if you tell night aggravation for Sambucus nigra, a lot of remedy has. but can inspire and cannot expire. That is Sambucus nigra. Child suddenly awake is बहुत घुटन से उठता है और सांस की तकलीफ होती है, पूरा पेल पड़ जाता है, नीला पड़ जाता है. दैट इज सैम्बुकस नाइग्रा. ओके सर, मुझे किडनी की इन्फेक्शन था. ओके, कल्चर रिपोर्ट करवाई है, उसमें बैक्टीरिया आया है. सर, एनी स्पेसिफिक रेमेडी फॉर नेल बाइटिंग इन चिल्ड्रंस फॉर यंग पीपल? या डॉक्टर मयूर, वेरी इंटरेस्टिंग क्वेश्चन. एंड I would like to tell you that when I was very practicing homeopathy, very young, maybe 10 years back, I also used to think something specific for nail biting, and I used to see the repertory also, nail biting. But let me tell you one thing. Nail biting basically is a disease of stress. You're thinking something and biting the nail. So it is more related to mind rather than the nails itself, So nail biting, if you see, basically in a mater medica, the remedy aconite is there, arsenic is there, lycopodium is there, veratrum is there, tarantula is there. But I would like to tell you, go basically to the mental symptom and prescribe nail biting rather than what remedies I have told you for nail biting. Of course, these remedies also have a mental picture. So do compare this with your patient and ask the mental picture, and you will be able to prescribe better, Argentum metallium. Yes, very nice, Dr. Purva, and thank you for sharing your results. Anxiety disorder. Yes, so see, this is anxiety disorder. No, this is what I'm telling you. So biting nails and anxiety, this is a stressful disorder, and there are a lot of remedies. What remedies which I have told you basically covers that part also. Anxiety, like lycopodium is there, arsenic is there, veratrum, tarantula, magnesium is, meccarb is there, aconite is there. So do try to take that symptom and compare that, and you'll get the remedy. Infection case is much better by 07. He started walking by this. Oh, fantastic, Dr. Meera. Yeah, I remember that case. I think you had asked me that the patient was admitted to the hospital, and I told you to share the results. And if you got LM7, fantastic, Dr. Meera. I think you are doing great work and really helping the suffering humanity. So very, very nice. So I think 3 cheers for Dr. Meera, and she's definitely getting good results by hearing that YouTube and also fantastic. Thank you for sharing, Dr. Meera, and I hope you continue to get such good results in your practice. Sir, please tell this case. Which case? That case of Dr. Meera. We had discussed that case, last time, and I told her to give arnica, and she is better now. Case of atopic dermatitis in 2 years old child, rash, face, skin fold, abroad, overeating stage. Yeah, see, atopic dermatitis again, Dr. Razik. Basically, it's a disease where it is sometimes taken as autoimmune, and you have to take the whole case before you start prescribing the remedies. Don't only prescribe for that itching and that dryness of skin, because only you'll be able to treat that dryness till the medicine is taken and then back to square one. So make sure in that case you definitely ask the history of the child of the mother during pregnancy, the family history, and then go to the child and some symptom which are very, very but not specific, but the symptoms in the child which are very, very symptom that defines the whole personality. Take that symptom in case of atopic dermatitis. I also have used to first prescribe only on skin itching and dirty skin and discharges, sticky discharge, water discharge, but it only heals till that medicine is given. You withdraw the medicine after some time, back to square one. Then you increase the potency. Then again it is better. Then again back to square one. Then you again increase the potency. Don't do that. Take the whole case. Dr. Venkat, that was a case of, I think, the patient had fallen down or met with an accident, and there was hemorrhage in the head, and the patient was admitted in the ICU, and that was the case which I told Dr. Meera to prescribe arnica, and now she is writing that the patient has started walking. That was the case. Okay, and it is very important that the doctor shares the case which I have told the remedy in the YouTube, so that we all learn. That learning is very important. Nobody can master homeopathy, and nobody is a master of homeopathy because everybody is a student. It's such a wide range of action of homeopathy, and you can't learn homeopathy at least in one generation. That's what I feel. Dr. Komal joined. He joined late, Dr. Komal. So can we have, in fact, biting nails, Dr. Mayur, I just remember one remedy which I had cured a case, Dr. Mayur, with Brata carb. I had a case where I had cured that case of, that case had a lot of anxiety problems, a lot of problems in the childhood, he had an inferiority complex and all, and I cured that case with Brata carb. That's to high fever. See, whenever you are taking a case of fever, of course, not always easy to treat case of high fever, and whenever you have LM potency, Dr. Venkat. When you're treating cases of high fevers, make sure what the patient is doing at the time of fever. This is very important, because if the patient is, maybe if the patient says that my child, whenever he is high fever, he talks too much, he keeps on talking, the remedy changes. Sometimes the patient, whenever the patient is high fever, in still high fever, he wants to eat, or in still high fever, he wants the fans and everything, what you call, closed, or in high fever, he wants all the fan open in high. So whatever the patient has, the constitution has changed or given more symptom at the time of that fever, that is more important to take, and then followed by the thermals and thirst, and you can get the remedy. If you have LM potency at that time, repeat every after 15 minutes, and you will get good results. सर क्या क्लेब्जिला, निमोनिया, बैक्टीरियल यूरिन के ट्रीटमेंट की होम्योपैथी? नहीं, स्पेशल दवाई तो कुछ नहीं है मेरे पास डॉक्टर हुसैन, बट क्लेब्जिला अगर इन्फेक्शन है तो स्पेसिफिक तो नहीं है, बट इन्फेक्शन के लिए अगर आपको कुछ भी समझ में नहीं आ रहा, बाई चांस अगर आपको यूरिन के तकलीफ में, तो 2-3 दवाई जो बहुत कॉमनली हम यूज़ करते हैं, आप यूज़ कर सकते हैं कैंथेरिस, आप यूज़ कर सकते हैं उवा उर्सी, और आप यूज़ कर सकते हैं टेरेबिंथिना। ये 3 रेमेडी में यूरिन के लगभग सभी सिम्टम कवर हो जाते हैं, तो आप ये यूज़ कर सकते हैं। मेरे ख्याल से होम्योपैथी में क्लेब्जिला भी एक दवाई बनी हुई है, आप वो भी ट्राई करके देख सकते हैं। डॉक्टर मयूर सेज, पेशेंट सेज, डॉक्टर साहब मुझे कोई कुछ बुरा कहता है और आफ्टर आर्गुमेंट आई फील अनकंफर्टेबल. No, so if see basically the patient does not like रूडीनेस. मतलब कोई चिल्ला के बोला, कोई गुस्से से बोला, कोई आर्ग्यूमेंट किया तो मुझे पसंद नहीं है. यू कैन टेक अ सिंपल रूब्रिक एलिमेंट्स फ्रॉम रूडीनेस. ही डज नॉट लाइक इट. उसको रूड बिहेवियर पसंद नहीं है. जैसे हमारे पास रेमेडी है, सबसे मेन रेमेडी जो एलन स्क्लेरोन में क्या लिखा हुआ है कि एलिमेंट्स फ्रॉम रूडीनेस. रेमेडीज कौन सी है? स्टेफिसेग्रिया है, लाइकोपोडियम है, कैल्केरिया कार्ब है, कोल्चिकम है, पल्सेटिला है. बहुत रेमेडी, ये रेमेडी मुझे याद आ रही है कि क्या बोलता है एलन स्क्लेरोन के स्टेफिसेग्रिया में क्या बोला गया है कि द पेशेंट वेंट होम, ही कुड नॉट आंसर, द पेशेंट वेंट होम ट्रेमलिंग, वो लिखा गया है स्टेफिसेग्रिया. सो रूड बिहेवियर पसंद नहीं है, एंड दैट्स हाउ एलिमेंट्स ऑफ रूडीनेस यू कैन टेक. Dr. Mayur says, sir, watch your constipation and diarrhea videos. Thank you so much, and I'm happy that you are using that YouTube platform. And believe me, it's only the clinical symptom which I've seen in my practice. Of late, I have done YouTube video of skin polycrest remedies, like I have done CP, I have done Natrimur, I have done Kali Carb, I have done these type of remedy for skin complaints. Do watch that video, because we never prescribe Calcarea Carb or Kali Carb or Natrimur or CP specific for skin. Those remedies are very, very important indication of skin. Clinically, what I have seen in my practice. So you can go and see those videos. They are very helpful. And that's what I feel, So I think it's already 3:30. It's already 30 minutes up, and 30 minutes go like it's already like 30 seconds. It is so fast. Thank you, Dr. Mayur. Thank you for seeing those videos, and I hope it helps you in your practice. So everybody, thank you for joining in, and hope to meet you on next Saturday for next YouTube live. Thank you so much.